A very good afternoon to our respected judges and one and all present here. Myself, Dr. Neela Priyadashini. My topic is prevalence and its related risk factor of glaucoma among adult patients attending the tertiary care center covering Kanchipuram district, a cross-sectional study. Introduction: the glaucoma can be defined as a progressive neurodegenerative optic neuropathy causing structural as well as functional damage to the retinal ganglion cell, resulting in progressive loss of visual field with or without raised intraocular pressure, resulting in blindness. It is the second leading cause for the permanent vision loss, and it was estimated to be around 65.5 million individuals were affected by glaucoma in 2020, and it may reach up to 80 million by 2040. Major risk factors for this disease include age, race, gender, and family history of the disease. People with glaucoma may show blurred vision, eye pain, headache, and hyperemia with or without systemic disease and medication in case of secondary glaucoma. Glaucoma can be diagnosed based on the sign at the time of examination. Examination with slit lamp microscopy, tonometric measurement of intraocular pressure, evaluating the structural effect of intraocular pressures on optic disc with imaging helps to confirm the diagnosis. Need of the study: glaucoma has been termed as the silent thief of sight, as the visual loss occurs gradually over a long period of time and symptoms occurs when the disease advances. Glaucoma is one of the preventable causes of blindness. Glaucoma shows 50% of the patients affected with glaucoma is unaware of the disease. Awareness of glaucoma will help in early diagnosis, management that can prevent severe visual loss and visual field defect. Objective of my study include to determine the prevalence of glaucoma among adult population, to identify risk factors associated with the glaucoma among the study group. Type of study: it's a hospital-based cross-sectional study of population more than 40 years of age people attending ophthalm OPD, which is from March 22 to February 2023. It is a place of study. It's occurred in tertiary care center covering population of 30 villages of Parandur block, PHC, Kanchipuram district, Tamil Nadu state in India. It's a study tool, a pre-tested and pre-designed questionnaire for assessing the risk factor. Inclusion criteria include age group of above 40 years of age, patients willing to participate in the study. Exclusion criteria: patients with eye infections such as conjunctivitis, keratitis, uveitis, scleritis, and also with perforating injuries, foreign bodies, and corneal opacities. Sample size was calculated with prevalence of 4% and precision of 10%. It is estimated to be 68. Methodology: after getting an informed written consent from the patient, the questionnaire was distributed to collect the necessary data on the socio-demographic variables, past history, medical and post-ocular history, followed by ocular examination with intraocular pressure measurement. My research shows the association of some socio-demographic factors with glaucoma, which include significant results with age and also significant results with family history of glaucoma, hypertension and diabetes, and intraocular pressure. In my study, the prevalence is of about 24%, and the clinical subtypes of glaucoma include primary open-angle glaucoma, primary angle closure glaucoma, and secondary glaucoma, of which primary open-angle glaucoma seems to be most common type, which include 43.80%. These are the other parameters. My discussion: from this study, we found that the overall prevalence of glaucoma is about 24%, which is similar to the study conducted by the Hyde et al., where he found the prevalence is around 26%. The study conducted by Hasan also shows the prevalence is 4%, which is very low, and contrast to our study report, this is maybe due to the sample size selection. In the present study, we found that age, intraocular pressure, comorbidities like diabetes, hypertension, and family history shows significant, which is similar to the study conducted by the Garudadre et al. Another study of Nagnavi et al. Shows that the glaucoma with association with old age and high blood mean pressure, which is also similar to our study report. In this present study, we found that primary open-angle glaucoma is the most common subtype, which is also coded in another study, Jacob et al., where he also coded that it is of 40.1%. Conclusion: the prevalence of glaucoma was considerably high among adult population. Major risk factors confirmed by this study include family history, older age, high blood pressures, and comorbidities. And primary open-angle glaucoma seems to be the most common subtype glaucoma detected in this study. Therefore, increasing public awareness about the identifiable risk factors of the early detection of glaucoma and preventing visual loss and visual and field loss. These are my references. Thank you.
Just one comment.
Sure.
So when you prepare the PowerPoint, so you have shown so many references as a uppercase. So I don't see any references downstairs. So you be careful when you prepare the slides.
Okay.
It shouldn't be clustered in the sentence formation and the ratio between the heading and the contents. So next time, so you can think of
We can code in last
and
time.
contrast. There's so many things when preparing the slides PowerPoint.
Sure,
so
sure.
you can consider that.
I'll
Thank
cut it
you.
next.
Yeah,
Thank you.
you.
Easy actually. Yeah, you have to clutter.
Yeah.
And it's a prevalence study, but you have not mentioned important prevalence study which was done Chennai glaucoma.
Aravind High Hospital has done a prevalence study, sir, which was the only study which is in South Tamil Nadu population, which was studied.
Chennai glaucoma study.
Sir, Chennai, South Tamil Nadu population, which was also. Along with that only, I calculated my prevalence.
The glaucoma is in the country is also increasing.
Sir, it has become an economic, it affects our national growth also, sir, because it is estimated to be increasing by 2040. By screening, having a lot of campaign and all, we can prevent that undetectable cases. Unfortunately, 90% of the cases were undetected, and it is mostly occupying above 40 years of productive age group. It will affect our economical side also in a long picture. So it is very important, crucial time to early detection and timely treatment to prevent this study.
Thank you.
Thank you.
Only that said that not only in the rural population, in the urban population
Yes,
also
sir. Since my college is situated there, I made a study. In long term, future study, I'll make it as a big population.